So insulin injections and what is the insulin technique? This is what we are going to learn here. So first is you need for the preparations. What are the things that you would like to know? Is that you should have insulin pen. You have an alcohol swab for the cleaning. You probably need a proper needle for it. Clean the hand. Check the insulin unit that are present. That means that if you want to administer 2 units or 5 units or 15 units, does it have it or not in the pen? Mix the insulin very well. That's very important. And safety check. Do you do the safety check? You dial 2 unit and then press it so that you make sure that you are not inserting any bubble. The the drop of the insulin should appear on the tip of the needle. So inspection. So before you start with the insulin, you first need to inspect for the site. The sites are on the abdomen, in the four quadrants, two finger breadth, and in the thighs, and you can use it alternatively. So you have right thigh, left thigh, and then you have abdomen. In abdomen, you divide it into four quadrants: right, left, and upper and lower. So upper right, upper left, lower right, lower left. So you have four quadrants in the abdomen. In the thigh, it is the same. You also divide it into four quadrants, and you have four quadrants in the right thigh. You have four quadrants in the left thigh. So you have total 12 injection sites where you use it alternatively in order to avoid lipodystrophy. The lipodystrophy is actually the fat accumulation. If you continuously inserting it in a single site, this is going to make a kind of a fat deposition or a lump, which makes the insulin very less effective. So first, how are you going to do it? You first need to load the insulin, and then two finger breadth away from the belly button, and then you hold the subcutaneous fat skin, and you hold the pen like a writing pen, and then you keep the pen perpendicular to the skin. Okay, so this is how you don't do it as an injection where you do it in a not a perpendicular way, but here you're going to do it as a perpendicular way. So then press the dialer completely and wait for 10 seconds. After it finishes, then you withdraw the insulin pen. So this is how you look at the insulin injections. So you see this is the cap, and here it's the name of the insulin, which type of insulin, what is the brand, what is the trade name. Does it have mix one, does it have short acting, does it have long acting? All the informations you will see here in the label, and then you see here the numbers, and then this is the dial. Numbers is when you load the units, you will see the numbers here, and this pointer will say that okay, at this moment of time this insulin is loaded with 0, is loaded with 2, is loaded with 4, whatsoever. So let's have a closer look of this. So you see here, this is the needle, and over here you see that there are total units present in a insulin injection. So this insulin pen has approximately maybe 300 units on the whole. Okay, so when if the cork here is the cork. If the cork is, you don't see a cork here, it's up there, so that means it is full. The decrease the cork is, that means that you have now 200 units. If the cork is at 150, you see that okay, now there is 150 units are left, and 100 units are left, and then 50 units are left, so on and so forth. Now we'll see the different parts. So insulin pen has a needle, and you need to just rotate the needle to put it to attach it to the attachment point. Then this is insulin reservoir, the total amount of insulin present. And then this is the cap. Okay, and this is the cap, the whole cap of the needle. And then you have here the name of the insulin, the type of the insulins, and then you have dose adjustment dial. This is the dial where you in through which you adjust the doses. And then this is injection button. You press it when you have inserted into the skin, and then you have loaded the insulin pen, and then you would like to administer. So by how you're going to administer? By pressing the injection button. So here you see insulin cartridge, and this is the you should have a finger here, dialer here, and numbers here. So this is how you're going to see the insulin injection, and this is how you're going to administer the insulins in the diabetic patient.